by roots. Now, what are these roots? Roots are the nerves, spinal nerves, ventral rami of which form a plexus, and that is known as brachial plexus. Now, upper limb develops opposite lower cervical and first thoracic segment. So, brachial plexus is formed by C5, C6, C7, C8 and T1, 5th, 6th, 7th and 8th cervical nerves and the first thoracic nerve. Now these nerve roots, they lie in the lower part of the neck, in the posterior triangle of the neck. So from all these nerves, the fibers, the ventral lemma, they pass downwards and laterally in the posterior triangle of neck, and these nerve roots, they appear between the scalenus medius and scalenus anterior muscle in the posterior triangle of neck. Now we'll see how the trunks are formed. So C5 and C6 root, C5 and C6, they unite and they form upper trunk of brachial plexus. Okay, let's make this a little bit thicker. Okay, so now what happens? C5 root and C6 root, they unite and they form upper trunk of brachial plexus. C7 continues as the middle trunk of brachial plexus. C8 and T1, they unite and they form lower trunk of brachial plexus. So this is how three trunks are formed. These are the roots: C5, C6, C7, C8 and T1. C5 and C6 unite and they form upper trunk of brachial plexus. C7 continues alone as the middle trunk of brachial plexus, whereas C8 and T1, they unite and they form lower trunk of brachial plexus. Now each trunk of brachial plexus divides into divisions. So this upper trunk, it divides into anterior division and a posterior division. Once again, middle trunk also divides into anterior division and posterior division. Lower trunk again divides into anterior division and a posterior division. The reds are the anterior division or the ventral divisions, blue are the posterior divisions. Now let's see what happens. Anterior division of the upper trunk, this, and the anterior division of the middle trunk, they unite and they form lateral cord of brachial plexus. So this is how the lateral cord is formed. It is formed by the union of anterior division of upper trunk and anterior division of the middle trunk of brachial plexus. Anterior division of the lower trunk, it continues as the medial cord of brachial plexus. Okay, anterior division of the lower trunk, it does not unite with any division. It itself continues as the medial cord of the brachial plexus. And what happens to the posterior divisions? All three posterior divisions, upper, middle as well as the lower, this all three unite and they continue as the posterior cord of brachial plexus. So these are the roots: C5, C6, C7, C8 and T1. C5 and C6 root unite and they form upper trunk. C7 continues as the middle trunk. C8 and T1 unite and form the lower trunk. Now how the lateral cord is formed? So lateral cord is formed by anterior division of the upper and middle trunk. Okay, anterior division of the upper and the middle trunk. Medial cord is formed by the anterior division of the lower trunk only, whereas the posterior cord is formed by the posterior division of the all three, upper, middle and lower trunk. This is how the brachial plexus is formed. Now let's see branches of the brachial plexus. So from the root there are two important branches. One is the dorsal scapular nerve. It arises from the C5 root. Another one is the long thoracic nerve. Okay, this long thoracic nerve, it arises from the C5, C6 and C7 root. So we can draw long thoracic nerve like this. This is the dorsal scapular nerve from the C5 root, and this is the long thoracic nerve from the C5, C6 and C7 root. Dorsal scapular nerve supplies the rhomboids muscle, whereas this long thoracic nerve supplies the serratus anterior muscle. From the upper trunk, there are two important branches. One is the nerve to subclavius, which descends in front of the brachial plexus. Another important branch is the suprascapular nerve. Okay, it conveys fibers from the C5 and C6. This is the suprascapular nerve. Its suprascapular nerve supplies the supraspinatus, shoulder joint, and infraspinatus muscle. Whereas the nerve to subclavius supplies the subclavius muscle. Now this point, here we can see this point on the upper trunk is known as Erb's point. Okay, here 6 nerves meet. Which are these 6 nerves? If you look at it during dissection, apparently you can see there is C5 and C6 root. Then there are two branches arising from it. Nerve to subclavius, suprascapular nerve, and then there are two divisions, anterior division, posterior division. So this 6 nerves, they meet at this point, and that is known as Erb's point. Okay, so these are the branches from the roots and the trunks. Middle and lower trunk do not give any branches. Now branches from the cords of brachial plexus. So medial cord gives medial pectoral nerve, medial pectoral nerve, then medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve, and medial root of the median nerve. This suggests the medial root of the median nerve. So medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then it continues as the ulnar nerve, and it gives medial root of the median nerve. Lateral cord, it gives lateral pectoral nerve, musculocutaneous nerve. Okay, let me make it little thicker. Anyway, so from the lateral cord there is lateral pectoral nerve, musculocutaneous nerve, and then it continues as the lateral root of the median nerve. So here two roots they unite, and trunk of the median nerve is formed. Lateral root, medial root. So branches from the medial cord: medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then the medial cord, it gives medial root of the median nerve, and rest of the fibers they continue as the ulnar nerve. Lateral cord, lateral pectoral nerve, musculocutaneous nerve, then it continues as the lateral root of the median nerve. It unites with the medial cord, medial root of the median nerve, and forms the median nerve. Branches from the posterior cord. So posterior cord gives axillary nerve. Okay, it gives axillary nerve. Then on the posterior wall of the axilla, it gives upper subscapular, thoracodorsal nerve, lower subscapular nerve. The middle one considered as the thoracodorsal nerve. Then it continues as the radial nerve. Continuation of the posterior cord is the radial nerve. So branches from the posterior cord, they include axillary nerve, upper subscapular, thoracodorsal, lower subscapular nerve, and the continuation is the radial nerve. So this is how important branches from brachial plexus arise. I hope I have tried to explain you as in a very simple way. Certain details I have not included in this video just to keep it simple and for students understanding. Now here, if C4 root joins this brachial plexus, if it gives fibers to brachial plexus, then it is known as prefix. If T2 gives fibers to brachial plexus, then that kind of brachial plexus is known as postfix brachial plexus. So commonly it is C5, C6, C7, 8, T1 root. If C4 gives fibers, then it is prefix brachial plexus. If T2 contributes fibers to brachial plexus, then it is known as post-fixed brachial plexus. Okay. Thank you.